Welcome to the Explainer. Today we're taking something that probably makes you squirm, and, well, we're going to turn that natural aversion into absolute awe. We're diving deep into the incredible science of leech therapy. If you've ever shuddered at the thought of a leech, get ready, because we're about to completely flip the script. We are taking a creature you probably associate with, dark, muddy swamps, and reintroducing it as a highly sophisticated medical instrument. So, I know exactly what you're thinking. A bloodsucker? Really? It sounds like some chaotic, unhygienic medieval nightmare, right? But what if I told you this tiny, unassuming creature isn't just some relic of the past, but an actual FDA-cleared medical marvel? Seriously, we are talking about an animal actively used in state-of-the-art reconstructive surgeries in the best hospitals around the world right now. Here is a quick look at our roadmap for today. First, we'll answer, what is a Jalauka? Then we'll cover the 12 types of leeches, unpack their biochemical saliva cocktail, look at ancient and modern uses, and wrap up with some truly bizarre leech care facts. All right, let's jump right into section 1. What is a Jalauka? Ancient Ayurvedic texts highly revere this creature. The term Jalauka literally translates to water is its life, combining Jala for water and Ayu for life. And these texts point out that the purest leeches survive only in the absolute cleanest, sweetest water. They rest gracefully on lotus leaves rather than, wallowing in the murky mud. It's a concept that grounds the therapy in this profound ancient wisdom, treating the leech not as a pest but as a vital part of a healing ecosystem. And this therapy, it is definitely not some new alternative health fad. The medical use of leeches stretches all the way back to the Stone Age. We see evidence of them being used in Egyptian tombs dating back to 1500 BC, and roughly 2,000 years ago, the practice was meticulously documented in the foundational Ayurvedic text, the Sushruta Samhita. And then, jumping way forward to 1884, modern science finally started to catch up with this ancient knowledge by isolating a powerful compound called hirudin right in the leech's saliva. Moving right along to section 2, the 12 types of leeches. Here is where it gets really interesting. Ayurveda precisely classifies 12 types of leeches into 2 perfectly symmetrical groups. You've got 6 poisonous types, known as savisha, which you absolutely positively want to avoid. And on the flip side, you have 6 non-poisonous types, called nirvisha. These are the ones brilliantly selected for healing. The texts provide these wonderfully vivid descriptions so practitioners can spot the safe ones. Take the copula leech. It's colored like a green mung bean with sides the color of a vibrant red mineral called realgar. Then there's the mushika, which, and this is amazing, has the shape, color, and literally even the scent of a mouse. Or the savarika, which is colored like beautiful lotus leaves. These safe leeches are strong, eager, and they originate from purified aquatic plants. But you definitely need to watch out for the poisonous ones. A bite from a savisha leech can cause severe fever, swelling, delirium, and intense itching. There's the Krishna, which is pitch black like powdered coal eyeliner. There's the Gochandana, with a narrow tip and bifurcating lines resembling a bull's scrotum. And the deceptively beautiful Indrayuta, which actually has striking rainbow stripes down its back. These dangerous guys usually come from stagnant, turbid water full of decomposing matter. Okay, section 3, the biochemical saliva cocktail. Over 100. Just let that sink in for a second. Over 100 bioactive compounds are found in a single medicinal leech's saliva. It's completely mind-blowing when you think about it. The therapy isn't just about removing blood from the body. It's actually a highly targeted delivery system for the powerful, natural medication the leech injects into the patient while it works. They are essentially packing a miniature pharmacy right in their mouths. And they execute this highly coordinated sequence. First, they inject natural anesthetics, so you barely even feel the bite. Actually, scratch that. A lot of the time you don't feel it at all. Next comes hyaluronidase, which is the spreading factor that breaks down connective tissue to let the drugs in. Finally, these powerful anticoagulants like hirudin, cagelin, and distabalase go to work, stopping clots and keeping the wound cleanly bleeding for up to 12 hours. Let's look at section 4, ancient and modern uses. The practice of Jalauka isn't just forgotten history. Today, it is the subject of rigorous, peer-reviewed clinical research. Modern scientists are literally looking through microscopes to verify the exact mechanisms that ancient Ayurvedic physicians mapped out thousands of years ago. It's a fantastic bridge between traditional texts and contemporary evidence-based medicine. In the US right now, leeches are actually FDA cleared for flap salvage in reconstructive surgery. Let's say a severed finger is reattached. The arteries can pump blood in, but the delicate veins often can't pump it out fast enough, which causes severe congestion. Well, the leech swoops in, acting like an artificial vein to drain the pooling blood, while its saliva actually promotes entirely new capillary growth. And in Ayurveda, the uses are even broader. They're used to treat varicose veins or Siraj Granthi, osteoarthritis, piles or arsha, and even severe skin diseases like psoriasis and eczema by purging vitiated, corrupted blood from the system. And finally, Section 5, Fascinating Leech Care Facts. The clinical application is beautifully structured into 3 very distinct steps. First is Purva Karma, which is all about preparing the patient and activating the leech. Second is Pradhana Karma, the main procedure where the actual bite happens. And third, Pashkat Karma, which is this absolutely vital post-care routine for both the patient and the leech itself. During the main procedure, the leech finds the perfect spot, sometimes coaxed along with a tiny drop of milk or sweet honey, and it starts drinking. When it does, it raises its jaw, the middle of its body elevates, and it takes on this distinct horseshoe shape. Even cooler, its neck begins to pulse continuously. Ancient texts beautifully describe this as looking just like the breathing rhythm of a sleeping little child. That gentle rhythm is exactly how the physician knows it's feeding properly. Okay, get ready for a truly quirky fact during the post-care stage. After the treatment, when the leech naturally detaches, Ayurvedic practitioners actually give the leech a massage. Yep, they sprinkle it with powdered rice, touch a little common salt to its mouth, and gently squeeze it from tail to head to make it vomit up the blood it just consumed. Now, why on earth would they do that? Well, according to Ayurvedic teaching, the leech cannot naturally digest the vitiated, diseased blood it just took in. If they don't get this post-meal squeeze to thoroughly empty their stomachs, the leech actually contracts a fatal, incurable disease called Indramata or Raktamata. They get heavy, totally inactive, and eventually die. So, proper care ensures the little guy survives and can actually be reused on the exact same patient a week later. So, we've covered their ancient origins, their classification, that powerful biochemical saliva cocktail, and intense care routines required to use them safely. Knowing now that this tiny creature bridges 2,000-year-old Ayurvedic wisdom with modern, FDA-approved surgical science, I have to ask, if the time came, would you overcome your fear and let a Jalauka heal you? Think about it. Thanks for joining me on this explainer.